In part 1, we talked about what recovery can feel like after surgery: pain, weakness, low appetite, bloating, movement, compression, and elevation. Now, let's talk about the other side of recovery, when something should not be ignored, because recovery should generally move toward improvement. And if the patient is getting worse, that deserves attention. Breathing is an important part of recovery. After surgery, people often take shallow breaths because of pain, tiredness, or lying down too much. The problem is, when the lungs are not opened properly, mucus can collect in the lower parts of the lungs, and the lungs may not open as fully as they normally would. That is why deep breathing matters. If the patient is given an incentive spirometer, they should use it as instructed. In simple terms, it is a tool that helps the patient practice slow, deep breathing so the lungs can open more fully. If the patient does not have one, slow, deep breaths while sitting upright can still help. Start by sitting up. Get comfortable. Take a slow, deep breath in. Hold it briefly for a few seconds. Then breathe out slowly. Repeat several times while you are awake as instructed. Pause and breathe normally between each breath. Do not rush. Do not do it until you get dizzy. The goal is to help the lungs open, not to exhaust yourself. If you are doing this well, it may make you cough, so that you can clear up some of that mucus. Remember to have your splint nearby. Difficulty breathing is not something to dismiss. Chest pain, severe shortness of breath, fainting, or sudden weakness that is getting worse should be treated as an urgent warning sign, and you should seek immediate evaluation by a qualified medical professional. A surgical wound may be sore to the touch, or sore with movement. There may be mild swelling or bruising, but the wound should not be getting progressively worse. Watch for increasing swelling. Watch for pain around the wound that is getting worse instead of better. Watch for skin that feels hot, tight, shiny, or more tender. Watch for redness if it is visible. But remember, on darker skin, redness may be harder to see. So, also pay attention to warmth, swelling, tenderness, skin that looks darker than usual, shiny skin, the wound looking more angry than it did before, or a change that is spreading around the wound. Watch for thick fluid coming from the wound. It may look yellow, green, white, brown, bloody, or cloudy. Sometimes it may smell bad. That kind of drainage can be a sign of infection. Watch for the wound separating at the edges. Watch for the wound opening enough that deeper tissue is visible. Watch for fever along with any of these wound changes. Those are warning signs. And fever after surgery should not be ignored, especially if it is persistent, high, or comes with the patient looking more unwell. A single mild temperature change may not always mean a serious problem, but fever with worsening pain, confusion, vomiting, wound drainage, breathing difficulty, or weakness needs urgent attention. Families also need to pay attention to how the person is looking as a whole. Let's imagine a patient has gone home after abdominal surgery. On day 1, they are sore, tired, and moving slowly. That may be expected. On day 2, they are still uncomfortable, but they are drinking a little more, walking a little more, and the pain medicine is helping somewhat. That sounds like recovery is moving in the right direction. Now, imagine a different pattern. On day 2, the patient is getting weaker. The belly is more swollen. They keep vomiting. They cannot keep even water down. They are more confused. The wound is draining. They are more short of breath. This is a very different situation. This needs urgent evaluation. So again, the question is not just, Does the patient have symptoms? The question is the patient gradually improving or clearly getting worse? Before going home, patients and families can ask simple questions. What should normal recovery look like over the next few days? How much pain is expected? What kind of pain should worry us? What pain medicines are safe for this patient? Can we use warm or cold packs? Are there medicines this patient should avoid? When should the patient start walking? When should the patient start eating regular food? When should they start passing gas or having bowel movements? What should we watch for with the wound? How should we care for the surgery sites? When can the wound get wet? What symptoms mean we should come back immediately? Who should we call if something changes? Those are wise questions. Good discharge instructions reduce fear. They reduce delay. And they help families know the difference between healing and danger. If you are recovering from surgery or caring for someone who is, use the medicines as prescribed. Walk when allowed. Drink fluids if allowed. Do breathing exercises as instructed. Use compression stockings or other supports if they were prescribed. Elevate a limb if that was part of the recovery instructions. Watch the wound and watch the person as a whole. Ask yourself, does the patient look better than they did yesterday? Are they more alert? Are they drinking more? Are they moving more? Is the pain more controlled? Are they slowly doing a little more than before? If the answers to these questions are positive, then those are encouraging signs. But if the patient is getting weaker, more confused, feeling dizzy or faint, more restless, sleeping all the time and hard to wake up from sleep, more breathless or complaining of chest pain, unable to eat or drink, vomiting repeatedly, having a bad smell from the wound, having worsening pain, or clearly looking more unwell, do not stay at home hoping things will settle down. Get help early. Now, one thing I want to say clearly is this. Returning to the hospital after surgery does not mean the surgery failed. It does not mean you are overreacting. It means there is a concern and something needs to be checked. Sometimes the answer is reassurance. Sometimes the medications need adjusting. Sometimes the wound needs review. Sometimes the patient needs fluids, imaging, antibiotics, or further care. But it is safer to ask early than to wait until the person has gotten much sicker. So, if there is one thing I want you to remember, it is this. Recovery should not be guesswork. Pain, tiredness, weakness, bloating, and reduced appetite can be a normal part of recovery, especially early on, within the first few days after surgery. But the direction should generally be toward improvement. If the patient is getting worse, having episodes of fevers, vomiting repeatedly, struggling to breathe, becoming confused, unable to eat or drink, having worsening pain, or showing concerning wound changes, do not ignore it. Healing has a pattern, and when that pattern changes, it deserves urgent attention. This is Med Affairs with Dr. Osa. If this helped, share it with someone preparing for surgery or caring for someone after surgery. And leave your questions below. Until next time.